Okay, we have Dr. Melissa Toyos of Nashville, Tennessee, primary
Right,
practice, right?
right,
But also you have a practice in New York,
right.
and just right now we were having a conversation. Dr. Toyos is an ophthalmologist with a lot of experience using Visudyne or Verteporfin. Dr. Toyos, welcome to the podcast. Thank you so much for
Thank
doing this.
you. Yes,
Um,
thanks for having me.
Thank you. I don't know if you're aware, but there's been a huge following, especially on the Hair Restoration Network with Verteporfin. Once Dr. Barghouti did his trial
Right.
and had, really good results, there's been a lot of interest in Verteporfin, and I'm interested to hear from you, your thoughts as someone who, um, you know, has a lot of experience with Verteporfin. People have, asked about photos or light sensitivity and all that.
Yeah.
So let's get into it. If you could first just kind of give us a brief background of yourself and everything.
Yeah, absolutely. So I'm board certified ophthalmology. You're exactly correct on that. I've been doing oculoplastics for the entirety of my career, which is 26 years of practice. Primarily, New York, Nashville, Memphis. We travel around. I used to be in the Midwest as well. And I've always had an interest in aesthetic things. My background was biochemistry. I developed a skincare line. I'm always looking for things, unmet needs, essentially, trying to make things better, smoother, looking to see what the edges are. And I've always had a strong interest in research. So Visudyne has been on my radar as an ophthalmologist for about 30 years. It's been around for a long time, used for macular degeneration. And we had a special light that we would use. People would have abnormal blood vessels in their eyes. And when we would administer this medicine, it would be IV. So we would administer it in the office. They would have to cover up, they would wear gloves, face coverings, head coverings, and they would have to do that for several days. I'm not a retina specialist, so I didn't do those myself. But I distinctly remember seeing those people walking around, looking like burn victims, essentially, to protect against any abnormal reactions. So when I saw the research out of Stanford, I was immediately intrigued because I had familiarity with the molecule and then using it subcutaneously with hair transplants. And then I'm also using it for some of my facial plastics procedures. It really does behave very differently from the intravenous method that we used before.
Mm. So, I know that you've done a couple of studies. I believe the picture that you sent me was it of a strip or was it FUE?
Yeah, so the one of the pictures that I sent you was FUE, and we basically kind of shaved off a small strip because it was a female patient who just needed a little bit of augmentation up front. So we didn't have to do a big, huge graft. Now I sent you another picture of a patient where we harvested 3,000 grafts, and I used Visudyne or Verteporfin at the same time of his harvesting. You really can't even tell that he's lost any hair. I mean, we've got significant regrowth. I haven't quantified that yet, but I would say it's approaching 50%, maybe a little bit more.
Wow, I'm trying to get into Instagram to share that. I'm not sure if
Yeah,
you have those on hand that you could kind of
I
share your screen.
do. Yeah, let me share my screen with you. And I've got these. Let's see. I can find the button. Okay, there we go to share. Let's see. Might need to have my assistant help me help me share.
No worries. I could probably pull it up, maybe through images. I'm gonna try here. Um, I understand from I was speaking with Dr. Bloxham, who's another doctor who has done a
Right.
verteporfin trial, and he mentioned that you spoke with uh oh, it went away. You were sharing your screen and it went away.
Oh,
He
I was
spoke
sharing it.
with the CEO of Bausch& and Lamb, which is the company that
Yeah,
makes Visudyne,
exactly.
Verteporfin?
Right. So I've been working with Bausch& and Lomb for the entirety of my career. I'm actually the medical spokesperson for Lumify. I don't know if you know the redness reliever for eyes that works so well. Um, Yeah, I'm the medical spokesperson for them. So I've had a great relationship with the company. And then they have a new CEO, Brent Saunders, who's a terrific guy. And he actually has background with Allergan and Botox. So I knew if anybody would get this, it would be Brent. But they are very focused right now on dry eye, moving into a different space, putting together a lot of things for ophthalmology per se. And it really isn't on the radar, at least right now, for the purposes that we're using it for. But he's very aware, and I saw him in Miami just a month ago, and I showed him some of our results, and he's like, "Wow, I get it."
Let me share a question that just came in. Would verteporfin be helpful for people who have hair loss on their entire scalp? Kind of the F pattern dupa.
Yeah, for the entire scalp. It's an interesting question. I haven't done someone's entire scalp. So far, what I'm finding is full thickness wounds seem to be better than other ways of wounding the skin. Obviously, the verteporfin works once the skin has been wounded, and you can inhibit the fibroblasts that develop, and you can inhibit the scarring, help to regrow normal skin structures. We've worked with this de novo with my blepharoplasty, so I'm injecting it at the time I'm doing surgeries here, not only hair transplants, but blepharoplasties. And then I've also experimented with existing scars. So I've had patients ask me questions, what if I have a scar that's old? What can we do with that? So we've tried different modalities. I have a CO2 laser, so I would create a wound with the CO2 laser, inject verteporfin. CO2 always makes scars look better, but I'm seeing an additive benefit, a synergistic benefit with the verteporfin. And then we've also done something called skin seeding, which I think it's not a new concept, but I think we might be the only people in the US that have done it with a hair transplant machine, where we actually take areas of an atrophic scar, and you might have seen that picture on my social media as well. And we're removing atrophic scar and replacing it with healthy tissue, normally taken from behind the ear. And so we're replacing that and getting really great results when we combine it with verteporfin.
Wow. And you mentioned something really interesting when you were talking to the CEO and that he's aware of,
Yes.
people wanting verteporfin, but I'm not sure if does he understand the demand? I mean, I sent you the thread
Right.
that's on the Hair Restoration Network, 500,000 views,
I know.
thousands of posts. I mean,
Right.
I would think that for a company that is, you know, it's kind of fallen out of favor with ophthalmology, that this would present a new I mean, something that could re-energize, revigorate the company. It could, it
Yeah.
has a whole new thing. So it's almost like minoxidil, right? Started off as a blood pressure
Right.
medication. Nobody uses it for blood pressure. It's all hair loss, right? It was just a secondary effect that somebody found,
Yes.
and, I think verteporfin could be the same thing, when in conjunction with surgery, with any kind of surgery, and I love the
I
fact that
agree.
you're using it for other facial plastic surgery and stuff like that because it should be studied for everything. I mean, if it can really reduce scarring from what we've seen, I mean, I don't understand why it's not being studied by more surgeons.
Who
Do
would want that? Yeah.
Yeah, do you have any insight on that? Like, what is holding
Yeah.
other surgeons back?
So I was talking to a couple of other hair transplant surgeons actually last night and this morning about the same thing. From a company standpoint, the way I understand it is obviously, if you're going to go on label with something, you have to invest millions of dollars into getting an FDA approval. And I think really that is their big hurdle, right? That they're not really in a position to invest those millions of dollars right now. But, I'm with you. The first time I kind of heard this information, and then certainly when I had it in my hands and I was seeing the results, I was like, wow, like everyone's going to use this. The plastic surgeons are going to use it for tummy tucks, it's going to be used for breast augmentation. Um, it's relatively expensive. So I think there may be a rate limiting factor just in terms of cost. But yeah, I mean, if you had a choice of having a scar after surgery or not, I mean, who wouldn't choose no scar? And
Yeah.
then in hair transplantation, the possibility of regrowing hair for people that don't have enough of it. Wow. I mean, until my iPhone starts making 3D hair grafts, I mean, this is the next best thing for sure.
Yeah, I mean, to me, it's like if I was getting surgery and the doctor said, "Okay, um, we can inject verteporfin. The additional cost is, let's say, 2,000, whatever the it costs.
Right.
I think it would be crazy not to do it, especially with surgery. It's like, okay, let's just speculate you get 25% regrowth.
Right.
That's donor hair is finite. It's unlike
It
money.
is.
You can't replace it. So if you
Right.
can get 25% return, it's
Yes.
a good investment. It's
Yeah, the Wall
definitely a
Street
good.
guys would take that all day long, right?
Yeah,
Yeah.
absolutely. So, what have you seen in your practice in terms of regrowth, in terms of scarring?
Yeah.
Give us some of, what you're seeing.
Yeah, I feel like I've learned some practicality. I've been using this for a little over a year now. And the practical things I've learned are, when we inject this at the time of surgery, and there was a paper that just came out that said some people are experimenting with injecting at the time of wounding and then maybe a week later or even a month later. I haven't experimented with that. Really, all I've done at this point is at the time of surgery, at the time of transplant or blepharoplasty, facial plastics. But I've had really good results with that. Now, you do have some light sensitivity. So today I'm in Nashville, but often I'm in New York. What I've noticed is it stays in the skin for a few months. And as long as it's in there, it's helping to remodel and to reduce the fibroblast activity. So I've had people kind of go through their initial modifications, surgery, healing. I've taken their stitches out a week or so. And then they go, this one patient went to Hawaii, right? So everything was quiet when they were in Nashville and New York. But then as soon as she went to Hawaii, it was like it reactivated again. When the sun hit her forehead, she was like, oh, I feel that burning. So I think it lingers in the skin longer than it did even IV. And I'm being careful with how I'm protecting the skin because you can get a little bit of tanning. Um, on the face. So I'm protecting the skin a little bit more, and especially in the summertime and when people are closer to the equator. But in terms of the hair regrowth and transplants, I'm seeing that as early as 1 month. And I really don't have a lot of side effects in terms of burning. That can happen, especially again if they're in direct sunlight and closer to the equator. But that doesn't seem to last much longer than a week. I really haven't seen it last past 2 weeks. I'm really seeing that more with my facial, where there's less covering. I think the hair protects it to some degree. Yeah. So, I think that's what I've noticed. The more concentrated product and the more of the product I use, the better results I get. So I've seen results anywhere from, I'd say about 30% regrowth. And you mentioned like a 20%. I think some people have reported that number to my last transplant, a month ago, where I feel like I'm seeing something closer to 40, 50%. So I think the rate limiting factor again is going to be cost, but the more you use it seems like the better it works.
Wow, 40-50% is incredible. And that's the
Right.
case you shared here on Instagram?
Yeah, a blonde guy. You can see the
Yeah,
back of his head. Yeah. Yeah, we took 3,000 grafts, which normally, you that would show up as, a little bit lighter density. But his comment was he could barely notice any change, and I have to agree with him.
it's this yeah, I can't click on it for some reason, I have to sign in, but,
Yeah,
this is the case she's referring to, which is 3,000 grafts, and it looks incredible.
right.
And
He's
here's another
happy.
recent case, right? This is just a scar revision with verteporfin, or is that just
Let's see. We're doing lash and brow transplants, so that's the pictures I'm looking at right now. And then I do see that got, let me see if I can share.
okay.
You said I was able to share before, right?
Yeah,
Okay.
yeah, just have to accept it.
Am
Um,
I sharing here?
yeah, this is all
You can see it?
yes, yes,
Okay,
there you go.
great. So let me just pull up. Here is that first patient, right? Where we did one side with verteporfin, one side without. You can obviously see the right side, very dense regrowth. That was 2 months after the procedure. And then here's a picture of a blepharoplasty. You can see that the skin is regrowing. It looks like less of an
Oh,
atrophic scar, more like,
this is just I'm seeing is a YouTube thing. Here,
oh no.
let me stop sharing that. Um, yeah,
Oh,
it was just like a YouTube
technical
thing, but,
errors.
um, yeah, technical error, that's okay.
Okay.
Let me see if I can find I think you might have included this on LinkedIn, which let me see here. Well, the biggest thing, that hurdle that I've found with doctors is trying to source it. I have
Ah,
a doctor
yeah,
here in LA, Dr. Mohebi, who is interested in doing the trial, but he just can't get his hands on it. And I mean, I'm not a doctor, so I called Bausch and Lomb, and they sent me something where somebody can fill a form out, the doctor can fill some forms
right,
out,
right.
but do since you're like kind of like a spokesperson, would you be able to kind of assist us in kind of giving doctors, an opportunity to at least purchase it and try it out?
Yeah, I will do my best. Let me say that. I'm going to be with the team again, the global team, next month. And I do have conversations going on with Brent. So I think if the demand is there, he's a business guy, right? So maybe we could sway him if there's enough demand. We could maybe help him change his mind.
I mean, the demand is there. Somebody created a website, called verteporfin.org for Dr. Barghouti.
Yeah.
We had several people, you know, contribute out of their own money. I think somebody contributed like 15,000.
Wow.
So, there's a huge demand,
Yeah.
and patients, they wanna know, does it work? You know? There's been a lot of speculation, and yeah, there's some promising results, but if we can get like a multi-center study, like multiple doctors are kind of doing it at the same time with the same methods, and that's
Yeah.
why I've wanted to get you into contact with some of the doctors that are interested in doing it, because I think it would be worth kind of comparing notes and, okay, what's the dosage you guys are doing? How, you mentioned doing it right after the extraction or waiting some time, like, getting everyone on board doing the same thing kinda will make the study a little bit more credible, so
Definitely.
I think
Yeah.
that
So I'm on a text chain with Dr. Bloxam, Dr. Ted. Oh, there we go. Maybe I can share it here. Can you see that?
yes,
Okay,
perfect.
great. Yeah. I can show you a couple of other pictures here as well. Oh,
That's the one that you sent me, so
yeah,
there what I see here is, like, it's clear that the left side, um, is a lot more sparse, and right
right.
here, I mean, this is a big difference. This is a raised
Yes, atrophic
scar.
scar. Yep, absolutely. And I think I got the hang of this now. I'll show you one more, my
Yeah.
blepharoplasty. Um, yeah, so there's the blepharoplasty where the skin looks more like natural skin and less like an atrophic scar. Yeah. I'm sorry, remind me of the last thing we were talking about before I got distracted with sharing my screen.
Yeah, so, you were on a, text chain with
Yeah,
Dr. Bloxham, Dr. Ted Milne
right.
of the UK.
Exactly. So we were creating a study. I do a lot of research. I always have, and create protocols and kind of look into things. And we sort of created an idea of um, very loose outline of how we would go. And I've enrolled one patient so far. The biggest issue I'm having at this point is now that I know that it works so well, it's almost hard for me to justify having a control on one side, right? Because I want to fix it. I
Mm.
want them to have that dense hair growth on either side. Obviously, if you're going to have something that's approved, going through the FDA, you're going to need a big multi-center randomized double blind placebo controlled trial. And without industry support, I don't know how feasible that will be. But yes, obviously, in my mind, I think that question has been answered. It absolutely does work. And then now we're just figuring out the logistics and practicalities of how best to make it work and how to advise patients on what to expect.
Yeah, what a lot of patients don't realize, and what I just realized when I was, talking to, Zion, who makes a topical finasteride, topical dutasteride, and people always, "Well, why isn't it FDA
Yeah,
approved?" But you hit the nail on the head. It costs millions of
money.
dollars
Yeah,
to try to get that approved, and there's if there's no if they don't see that they're gonna make that money back, why would they do it,
right.
right? So, I think our job at this point is to kinda show them, "Hey, look, there's a real demand, and this stuff works. and the possibilities are endless. I mean, this is not just
Yeah,
hair transplants, it's all surgeries,
it's
it's
everywhere.
everything.
Yep.
It's even I mean, it's even if you fell down, you cut yourself or something, you go to a plastic surgeon and you don't like the way the scar's raised or
Right.
something, or
Mhm.
you get that injected and like what you just showed, it looks a lot better.
And
Is it gonna be
I think there's a
perfect?
huge market too, not just for the transplants that, we're doing immediately, but there's a lot of people out there that have big FUT scars. So we've been working with those guys as well, and women, to revise those scars, put new transplants in and grow that hair in so that, those scars are revised. Also, I'm going to say, we've seen some issues coming from Turkey, especially in the New York market. There's a lot of people that will travel, they get over harvested, they're over transplanted, with too much crowding. Overcrowding will cause some loss and looking like crop circles on different parts of their scalp. We've been able to help those patients successfully as well. So you're right, there's a huge market. It's not just hair transplants, it's a lot of subgroups within hair transplant, and then really every surgery or trauma that you could think of has an application.
Yeah, it just, it kinda baffles me the company isn't, I guess they're not seeing it that way, because for me, it's like I would think that they would be all over it. They would be like, "Let's do it. Let's get." I have so many patients DMing me all the time, wanting to be on a trial, even even saying, which doctors are doing the trials. I would fly to them. I would pay to be part of this
Right.
because they're that interested.
Yes.
So, it's that the demand is there. I think that so far, everyone I've seen who's done a study, which blocks them,
Yep.
Barghouti, you, all of the results have been good.
Yep.
I guess the main concern, and I guess kind of the pushback that people have been giving us, is that it's just photos,
Yeah.
right? It's not using any form of, like, AI
Yeah.
that can sort of scan the scalp and make sure, or even, doing some form of SMP to make sure that this is exactly where the graft extraction was done,
Right.
and to make sure that that growth is actually coming from there, and it's not like a telogen hair or something like that. What are your thoughts on really perfecting the studies?
Yeah, so what we were really looking at was density, looking at before the transplant and then at different time points, 1, 3, 6, and 12 months after the transplant, looking at hair density, and just kind of following that along because that really tells the story. Are we regrowing hair or are we not regrowing hair? But at this point, maybe you and I pool our money. Maybe there's some private equity guys out there who want to get in on this. We buy the rights to the verteporfin from Bosch and Lomb, and we just make our own company. Yeah,
Yeah, that would be interesting. That really would be interesting. I think there's a lot of opportunity, especially with kind of doing the study, like Dr. Mohebi in LA. He has rights to, I think, UCLA or one of the hospitals over here, and he has ideas on how to really kind of do the study and
sure.
and really high HD close up photos
Yep.
with SP, or possibly some form of like AI. There's AI that will
Can
scan your
scan.
scalp and
Uh-huh.
it'll scan and tell you exactly how many hair follicles are in that
Right.
particular area per square centimeter,
Correct.
and so you do equal sides, right? Equal
Yep.
extractions. You look at how many hairs are there after extractions, and then you can easily replicate that 6 months, 12 months later,
Yep.
and if there's more hair,
Yes.
then it's really pretty much undeniable that it's working.
You're exactly right. And the biggest issue I see with that, Melvin, is what you're going to do with the control side and how you're going to fix it to make it match.
Yeah. I mean, I think there's patients, though, that are willing to kind of accept, okay, this side may look a little
Yeah.
worse,
Yeah.
but their thoughts are that, okay, well, I'm gonna get more hair here, and so they're willing to go through with it, and they know it's for the greater good, it's gonna
Yes.
help people, it's gonna help us know whether or not this is something worth pursuing or not. So there's no lack of patients willing to say, "Hey, you know what? Make this a control side,"
Yep.
and you don't even have to do that many grafts. You could do
Yes.
maybe 100,
Yes.
do 100, and that's not gonna make a huge difference, but at least you'll know,
So if any of your
Um,
listeners are interested, we do have that trial up and running. I've got the paperwork. We're registered with the IRB, and we set our target at 10. And I've enrolled one so far. The second one that I enrolled decided that he wanted everything done, didn't want to be in the trial, just wanted the whole shebang. But if your listeners are interested, then they can look us up at toyosclinic.com and give us a call and be part of the study.
if they wanna email you,
Yes.
I don't know if you're comfortable with giving your email, could you provide the clinic email that they could,
Yeah.
reach out
I'm going to give
if
you
they're
my
interested?
direct email, mtoyos, so Melissa, like my first name, mtoyos at toyosclinic.com. And then I have two assistants that help me with my scheduling and answering questions and logistics. So yeah, we can do free telehealth for hair and give people more information and look at their individual situations.
Awesome. And would you be willing, I know this is a big ask because you're very busy, but would you be willing to maybe, create a profile on Hair Restoration Network and, every once in a while share your results
Sure.
on our thread, on our mega thread? I mean, let me see how much we're at to up to now. I think it's it's crazy. It's 5 almost 600,000 views.
Wow. Yeah.
Our
Oh,
3.2 thousand posts.
that's great.
So,
Congratulations. Yeah.
yeah, it's huge. So, I would love it if you would go on there and kinda share some of the results, some of the things you're seeing in your
Yeah.
practice. People there are very interested. They're hyped up on this, and I think it's fair. Some surgeons are like, "Oh, don't wanna jump the hype train," because 'cause I'm not sure
Yeah.
if you're aware that maybe like a decade ago, there was something called ACell,
Yes. Yeah.
which is it's FDA approved actually for wound healing and everything,
Right.
so it was kind of the same thing where, surgeons were using it, they're saying that it could regenerate hair, it turned
Correct.
out that it didn't,
Yep.
and the scarring, it for me, I didn't really see a
Yeah.
difference. It was marginal at best, but I think this is something different. I mean, in my opinion, I think this is something
I
that's
agree with you.
gonna be a lot better than ACell.
Yeah, and the proof is in the pudding. I mean, in science, things work or they don't work, and they work for other doctors. Can't just be magic hands, right? It works for one doctor, it works for another doctor. Um, and I agree. I think if I hadn't had the experience with Verteporfin as an ophthalmologist, I would have had a different idea because I totally agree. There are things that come out, they make a lot of promises, there's a lot of hype, and then it just doesn't pan out. And that's the science. I mean, you have to explore it, but if it works or it doesn't work, and if it doesn't work, it falls by the wayside. And if it does work, then I think it will continue to build and expand as word gets out.
Yeah, and one last question, before I let you go. I know you're busy, and thank you again for giving me this opportunity to interview you and talk about verteporfin. It's not common that I get to talk with a doctor who has a lot of experience with verteporfin.
Right.
You mentioned something earlier that kind of your background was based on, I believe, pharmacology or chemistry,
Yeah.
one of the two,
Biochemistry. Yep. That's my degree.
biochemistry. What are your thoughts on the Dalton rule? Because we have a lot of, like, especially with dutasteride, right?
Right.
Um, there's a group of people that believe that topical dutasteride is just too large of a molecule to penetrate the skin and that it won't work.
Yeah.
And then others say that it's right in the threshold. I forget. I think it's like 519 or something like that. And
Right.
it's a 500 rule, right?
Yep.
What are your thoughts on that?
Well, there's a limit to how much the skin can absorb. And so, in my experience, really everything that's systemic, whether it's minoxidil, dutasteride, et cetera, I've got people that don't want to take oral medications for one reason or another. Philosophically, they just don't want systemic side effects. It's great to have a topical option, but I've never found it to be as effective as an oral. And, of course, with minoxidil, we've got the scalp enzymes that genetically some people, process that topical minoxidil differently than other people. And so you're going to have people that are better responders than others. And, it can be a little bit messy. So I would say that in my practice, generally, I stick to I stick to the oral whenever I can, and I really only do topical when there's a compelling reason to do it, and people prefer not to do the oral, but I'll often use them together because they are synergistic.
Yeah. But do you think it can actually absorb? Like, in your opinion, do you think it
I think it can.
go
Sorry.
ahead.
Sorry, getting called away. Um,
Oh,
yeah, I think it can absorb, but obviously the pharmacodynamics, like the physiology of the scalp, how much is absorbed? Is it enough to be sufficient? Is it enough to be um, effective? I think those we haven't quantified those questions. We haven't done the research because these medications are generic and there's very little ROI to really see what's going on. But I think if you go on the internet, you're going to have people that have all the opinions, right? Yes, it worked for me, or no, it didn't work at all for me. But just what I understand from a medical standpoint, I'm always going to prefer the oral because I think we're going to get better results that way.
yeah. And you're prescribing oral minoxidil now?
A lot. That really is kind of my go-to. So we offer a compounded minoxidil that has retinol in it, prostaglandins. Again, with the intersection of ophthalmology and hair, I was a big Latisse user and actually consultant and speaker for the company when that first came out. So that was a glaucoma medicine that we found grew eyelashes, but it also grows brows and scalp hair, pushing everything into growth phase, make it longer, thicker, darker. So we compound our topical Rogaine with about 5 prescription medications to make it even more effective. So again, trying to just fill niches where we can improve and grow more hair and help people get the results that they want.
So you compound oral minoxidil with
hmm
Latisse
With
and then
Latisse.
other
Yeah,
oh
sorry.
my god,
So
yeah.
sorry, topical minoxidil. So the 5%
Oh, okay.
with
Topical.
prostaglandin, with retinol, anti-inflammatories, and some other, yes, proprietary things. But yeah, we're doing everything that's based on science, things that have results, that have data, to see those translational effects in the clinic. We want to see results, don't we? We want to grow some hair.
Yeah, awesome. Alright, just before I let you go, where can people reach you? Shout out your website,
Yeah.
your Instagram, so people who are watching can, reach you.
Right. So Toyos Clinic, www.toyosclinic.com. The office phone, 615-327-4015. I'm on Instagram, Dr. Melissa Toyos. I'm on TikTok, Dr. Melissa Toyos. Just Google me up and we can have a conversation.
Amazing. Thank you so much,
Yeah.
Dr.
Thank you
Toyos,
for the
for doing
opportunity.
the broadcast.
Yes.
Yeah, I hope this is my hope. I don't know if you're gonna be attending the ISHRS conference in Berlin,
I'm going to
so
try.
this is my hope. I'm I wanna have a dinner and invite as many surgeons as possible, and let's get the ball rolling on
Yeah.
vertiport. Let's do if the more surgeons do the study,
Yeah.
kinda and they all follow the same protocol, kinda around the same time, do a multi-center study, and, Dr. Ted Milne even mentioned, possibly maybe the ISHRS could sponsor some of it because it
Right.
is research,
Yes.
something that would be worthwhile. So, hopefully, we see each other there and you know, maybe next year we'll do a follow-up podcast on the results of that.
Yeah, well, thank you for
Hope
inviting me. You've obviously created a terrific community and network, and I'm honored to be a part of it. I would love to continue to contribute. And yes, let's get an A team together. I just got back from giving a talk on this very subject in Switzerland. People can find that on YouTube. And, let's keep exploring this together.
awesome. Thank you so
Good.
much, Dr. Toyos.
Thank you.
You have a
Time.
good one.